12 millimeters, and so I'm planning for a phakic IOL. This is an RIL. So normally I make two incisions, one on the inferior side and one on the superior side. So this is where I like to make the incision so that it facilitates better access. And I'm injecting preservative-free Xylocan. Am I audible? Hello?
Yes, ma'am, we can hear you loud and clear.
Yeah, okay, thank you. And I'm just now next stage is I'm putting a cohesive viscoelastic. So now next stage is going to be making an incision, which is 3.2 millimeter keratome. So normally most of the lenses go easily through a 3.2, so I prefer to use a 3.2, and so that it doesn't stretch the borders of the wound, and it gives a better wound stability. So now the lens is being loaded, and this lens, particular lens, has come without a central hole. So normally they do provide a lot of lenses with central hole. I think because of the lack of time, they have given this lens without a central hole. So it is very similar to an ICL, and you just need to look for the central hole in the upper portion of the haptic on the right side as you're injecting. It comes out very beautifully, very smooth, very nice. Good. So according to Sivanyanam, who's here with me, he says if there are 4 holes, you don't have to do a PI. So that will decide. That decision will be made by me. See, very nicely, it's beautiful. It's so easy to tuck it in. And you know, already I've made a superior opening here to facilitate the easy. See, this is easier. If you make it, then you make it at 180 degrees. The lens is gone inside. That's it. And because it's a spherical lens, you don't have to worry about the positioning much. And that's it. It's important you just remove all the viscoelastic and remove all the air also. See, air can sometimes block the, there is a central PI particularly, you know. There's a central opening, then it can block the central opening. So just make sure you remove everything. Initially, I like to flush out the viscoelastic, then you can always go inside with an IA and remove the viscoelastic through the IA. Much padikadappa. Saline put. Just holding us a bit. Much padikadappa and the much wood. Asay kudadu. Don't much padikada. வலிக்கிறதா முடிஞ்சு போச்சு இல்ல வாஷ் பண்ணும். Next patient is having a little bit of an upthrust. I think is anxious. So the volting is around 450 to 600 in this case.
Dr. Sujatha, is this lens available for the whole range of powers like myopia, astigmatism, and
Yeah. They have everything. All the ranges, toric, everything they have. It's very easy to insert and excellent to handle actually.
Wonderful. And incision size, that is the minimum incision size? Is it the
They
same
are
as
recommending they are recommending 2.8. Yes.
Okay, perfect. And what is the material, ma'am? I'm sorry, I joined.
This is hydrophilic. This is hydrophilic acrylic.
All right.
Gaurav,
Yes, sir.
we have implanted quite a number of RIL lenses. It's an hydrophilic lens. It's pretty good. The biocompatibility is really fantastic.
Right.
And very good results.
Yeah, it looks very nice, sir, and looks excellently centered and
easy to use. And
So
more importantly, it is Appasamy product. That's very important.
absolutely. So the support from Appasamy is always excellent. Sir, is it customized like some of the other companies are doing?
Yeah.
The part,
It's
like
yeah,
that?
see,
Or?
This patient had a 12 overall diameter, white to white, and they have given me a 13. So we can customize it. Normally, I prefer to go 1 millimeter above. And some of the cases, no, we are not able to get that. So these people are able to customize it. And
No, ma'am, I meant for the astigmatism. Do they customize it to be placed at
yes.
Yes.
And what's the turnaround time if you order a lens? Like in how much time will it supply?
It will
1 week to 10 days,
It
he
will
says.
take about 10 days minimum. But sometimes, off-label cases, then they might take a little bit longer.
And ma'am, what's the highest power of the lens that you have used so far, like customized?
They'll go up to up to 30 diopters they are willing to give.
Okay.
Only thing is all those things, off-label may take a little bit longer, but
Yes,
but still it is possible. So it's done.
Ma'am,
Fantastic.
PI is not required with this lens, right? Like just the other lenses?
Any questions, Gaurav, on the both?
Any PI need for a PI, sir?
Not necessary.
He says
Not
PI is not required, but I am planning to do a PI.